posture when you're sitting down, especially at your desk. You don't want to slouch, but instead you want to be upright. You gotta keep your chest up, your head up, your back straight, and your shoulders up. Also, remember to take a little break every hour or so whenever you're working or whenever you're gaming. Now, for some exercises that you can do, you gotta keep your back straight and you can roll your shoulders backwards for a set of 10, and you can also roll your shoulders forward for a set of 10. So 10 forward and also 10 backwards. Lastly, you can do the stretch at your desk. You can put your hand above your elbow and you can stretch your elbow. Lastly, you can do this stretch at your desk. You put your right hand above your elbow and you pull it down and you drop your head at the opposite side. You want to hold at this position for about 10 to 15 seconds. This will be able to stretch out your trapezius muscles and help you to relax your back as well as your neck. These are little stretches that you can do right at your desk. Remember, posture is really important, so keep your back straight, your chin up, and your shoulders square. Next, I'm going to show you some tips and eye exercises that will help eye strain due to computer vision syndrome. Let's take a look. A lot of us these days are spending more time in front of a computer screen or cell phone throughout the day, and when we spend this much time on a device that is only a few feet away from our face, it can cause muscle strain to our eyes. So, tip number 1 is to take frequent breaks. When you stare at a digital device for too long, your muscles will start to cramp up, and we call this as the accommodative spasm. To help relieve this, follow the 20-20-20, which means that for every 20 minutes you spend in front of a device, take about 20 seconds rest and looking at 20 feet away in the distance, just so that you can give your eye muscles a bit of a rest. Adjusting your environment can also reduce the risk of developing computer vision syndrome. What you can do is adjust your screen position. And lastly, you can use your eyes to look at different direction and hold it for at least 5 seconds. You can start by looking upward and hold it for 5 seconds, and you can repeat it in a different direction, whether you can go downwards, repeat for 5 seconds, and looking sideways. Hope these tips and exercises are helpful for you to practice anytime and anywhere. Enjoy the rest of the event and stay safe!
This is Hillman. Hillman recently found two white lesions on his two front teeth. He is very concerned with this matter, so he went to see the dentist. There are a few important structures of a tooth, which are enamel, dentin, cementum, and lastly, the pulp. Now, let us focus to the outermost layer of the tooth, the enamel. Enamel is composed of a hard substance called the hydroxyapatite. Hydroxyapatite is the type of calcium phosphate crystal with the chemical formula of Ca10PurePhos6OH2. In normal condition, there are numerous amounts of bacteria in our mouth. When the microcolonies of bacteria coalesce, it will create a layer of dental plaque on the tooth surface. The bacteria will metabolize the sugary food that we consume and produce acid as a byproduct. The acid produced can break down the hydroxyapatite, making the enamel surface to be weakened. Hence, there will be an appearance of white lesion on the tooth surface. This will be the time where the function of fluoride comes in. Fluoride can replace hydroxide in hydroxyapatite to create fluoroapatite through a process called remineralization. This process will reverse the early signs of tooth decay. In general, fluoroapatite is more dense and less soluble compared to hydroxyapatite. This means that they are stronger in protecting our teeth. Fluoride can also prevent the growth of harmful bacteria in our mouth. This shows that fluoride treatment is very useful throughout your life, and it is more important during childhood and adolescence. Fluoride can naturally be found in water. It can also be found from the soil, from the plants, and lastly, from the rocks. But we have water fluoridation, so we can get fluoride naturally from the tap water in our house. Water fluoridation in Malaysia was introduced by the government in 1957 at the state Johor. In 1974, the nationwide water fluoridation program was implemented with the installation of fluoride feeder in water treatment plants. The fluoridated water was then distributed throughout the cities. Evidence shows that water fluoridation has effectively reduced the population of dental caries in Malaysia. In water fluoridation program, the fluoride level is adjusted to the optimum level, which is 0.5 parts per million. While for toothpaste, fluoride is most effective at 1,350 to 1,500 parts per million. But Hillman has a water filter system at his home. Currently, there are 5 types of water filtration system that was implemented throughout the world, and reverse osmosis is the most commonly used system. So how does it work? The high water pressure will force the water that contains particles to a layer called semi-permeable membrane where the particles are being filtered. This includes the fluoride. This filtration system will leave only pure water to the other side of the filter. Fluoride is very important in maintaining our oral health. Tooth decay can be prevented with the regular usage of fluoridated toothpaste. It is recommended to take the appropriate amount of toothpaste during toothbrushing. Too much fluoride may cause fluorosis. Fluorosis is when there are appearance of plain white lines on your teeth. However, if you don't use fluoridated toothpaste, you may one day end up with a tooth decay. The dentist suggested Hillman for a fluoride treatment. He applied fluoride gel on Hillman's teeth to encourage the remineralization process to occur. Hillman can also use fluoridated mouthwash to reduce the risk of tooth decay. But it is recommended to always use the fluoridated toothpaste. After 1 month, the white lesion has disappeared, and Hillman is very happy with his teeth compared to the previous month. This shows how effective fluoride is to our teeth, and with proper care and management of it, we could reduce the cost and time of dental treatment and also to promote oral health among the society.
Today, our topic is about mouth ulcer. Let us hear what people say about mouth ulcer.
Oral ulcer, it's something that is growing inside your mouth and is very painful. Biting my inside lips.
When it is so hard and when you don't drink enough water. Oral ulcer is something painful that happen in my mouth. It happened when I bite my lips, my tongue. I put some salt on my mouth. I went to pharmacy buy some oral medicine.
No, I only know one type of oral ulcer and that is the painful.
No, I don't know. No, I don't meet dentist. Sometimes when the ulcer is too painful.
What is ulcer? Mouth ulcer is a small superficial lesion and erosion of the delicate lining tissue of the mouth. They are usually appear as a single or multiple ulcer, tender yellowish base of floor, red margin and no induration, and it is soft on palpation. They appear on soft tissue inside your mouth including lips, tongue, and teeth. Ulcer heals within few days after elimination of cause. For acute ulceration, it heals less than 2 weeks. Chronic ulceration heals more than 2 weeks. There are few different types of mouth ulcer, including traumatic ulcer, recurrent abscess stomatitis, hand, foot, and mouth disease, and others like oral cancer. Traumatic ulcer. Mechanical caused by thumb bites, appliances, and sharp teeth. Chemical burn caused by any chemical or drugs. Thermal burn caused by the hot food, and it heals in 7 to 10 weeks without scarring. Recurrent abscess stomatitis (RAS) includes minor RAS, major RAS, and herpetiform. RAS. Minor RAS. Size is less than 1 cm. Healing time few days to 2 weeks and heal without scarring. Next is major RAS. The size is more than 1 cm. Healing times is weeks to months and heal with scarring. Herpetiform. The size is small and multiple. It heals without scarring. Hand, foot, and mouth disease caused by the viral infection Coxsackie viruses. HFMD, common infection in children younger than 5 years old that causes ulcer inside or around your mouth and a rash or blister on your hand, feet, legs, or buttocks, and painful. It is transmitted through coughing or sneezing, close contact like kissing, hugging, sharing cups, or sharing utensils, contact with poop like when changing a diaper. Causes: injury to the mouth from vigorous toothbrushing, dental work, and accidental cheek biting. Sensitivity to certain food such as acidic food, spicy food, and coffee. Symptoms: burning, tingling sensation in mouth, difficulty speaking, eating or swallowing, fever, and weight loss. Management: maintenance of good oral hygiene. Use a soft-bristled toothbrush. Soft and balanced diet with folic acid, zinc, and vitamin B12. Adequate intake of fluids. Some home remedies include: place an ice cube over the affected area and allow it to dissolve. Rinse your mouth with salt water. Some lifestyle changes can also help relieve pain and speed healing. These may include avoiding spicy and acidic food, avoiding hot beverages, avoiding irritants like alcohol and tobacco, and avoiding biting or chewing your inner cheek and lips. Small ulcers tend to heal on their own without required treatment. However, large, persistent and painful ulcers often need care. Immediately meet a dentist for checkup. So, if your ulcer do not heal more than 2 weeks and associate with signs and symptoms, it is of utmost important to consult a dentist or medical practitioner. Come and see a dentist, prevent before become worse.
Sebagai sebuah universiti awam yang terbesar di negara ini, UiTM sememangnya memainkan peranan penting dalam melahirkan modal insan yang holistik dan seterusnya menyumbang kepada pembangunan negara. Tiada kejayaan yang datang bergolek. Jayakan segala inisiatif yang telah dirancang di peringkat universiti dan matlamat UiTM 2025 untuk menjadikan UiTM universiti terkemuka dunia.
Assalamualaikum warahmatullahi wabarakatuh. Semua warga UiTM. Individu yang positif berkenaan, kita kategorikan dia sebagai A kerana dia adalah positif COVID-19. So siapa yang berhubung rapat dengan COVID-19, positif COVID-19, kita kategorikan dia sebagai kategori B. So untuk kategori B ni, mereka kena melalui ujian COVID-19 untuk disahkan sama ada ujian mereka positif atau negatif. Sekiranya mereka positif, dia akan jadi kategori A pula. So kalau dia negatif, dia bebaslah, tetapi kategori B tetap kena kuarantin untuk 14 hari. Ya, so mereka kena kuarantin di rumah selama 14 hari. Arahan diberi oleh bahagian pejabat kesihatan daerah. Ya. So untuk sesiapa yang berhubung dengan kategori B yang sedang menjalani swab dan sedang menunggu keputusan, mereka adalah kategori C. So sesiapa yang kategori C ni di dalam pejabat pun ada, di college pun ada, pelajar-pelajar pun ada yang kategori C. So kita nasihatkan mereka juga perlu buat home isolation ataupun isolate diri di rumah ataupun di college masing-masing sehingga semua individu yang kita berhubung tadi, yang kategori B tadi dapat keputusan. Sekiranya B tu negatif, maknanya anda semua bebas yang kategori C. Bebas boleh datang kerja semula. Tapi sekiranya individu kategori B tadi positif, dia dah menjadi A. Jadi anda yang C ni tadi telah menjadi B dan anda pula lah kena swab pada tarikh-tarikh yang dimaklumkan nanti oleh pejabat kesihatan daerah. Untuk anak-anak pula sesiapa yang kategori B yang kita telah buat swab, anak mereka, ahli keluarga mereka adalah kategori C. So mereka pun sama. Mereka kena home quarantine ataupun isolate diri di rumah. Tapi bila kategori B tadi yang telah swab tadi negatif, mereka boleh balik ke sekolah. So janganlah risau. Dan kategori C juga, siapa yang balik ke rumah, anak dia adalah kategori D. Mereka boleh bebas pergi ke sekolah ataupun pergi ke mana-mana, tetapi mengikut SOP yang telah ditetapkan oleh Kementerian Kesihatan dan juga MKN.
Assalamualaikum and a very good morning to all the honorable panelists, professors, doctors, lecturers, and fellow friends. Welcome to our second day of the 11th UiTM Dental Students Scientific Symposium. Our theme this year is Dentistry Against All Odds, Revolutionizing Research and Practice. This oral presentation can be streamed on the Symposium Live Telecast YouTube channel on our website. Would like to request all presenters and all symposium participants to fill in the attendance link in our website for today's session. My name is Fatima Munira and I will be your moderator for today's oral presentation session. Our timekeeper is Ilmi Qayyim. Today, we are really honored to have Professor Dr. Rohana Ahmad from Faculty of Dentistry UiTM, Associate Professor Dr. Jamal Husani from Faculty of Medicine UiTM, and Dr. Hasina Binti Rani from Faculty of Dentistry UKM as our panel of judges for the main hall. Before we begin, please allow me to lay down a few house rules for today's session. The rules and regulations for today's oral presentation are: the first is, all presenters must be ready at least 10 minutes prior to your allocated presentation time. The second is, all presenters are required to use the provided virtual background in our website for the Q&A session on the scheduled slot. The third is, the pre-recorded video presentation will be played by the committee for 10 minutes and subsequently followed by a 5-minute live Q&A session by the judges. For the presenters, please ensure your camera and the microphone is turned on only during this session. The fourth is, the first bell will ring at 4 minutes of the Q&A session and another bell will be at the end of the Q&A session. After the Q&A session ends, the moderator will cue to the next presenter. The fifth, in case of any technical difficulties during the video presentation or the Q&A session, the other presenters must be on standby should the allocated time be brought forward or earlier. Without delaying any further, let's start with our first recorded oral presentation. Please welcome Farah Hanani binti Muhammad Rashid and Anisha Hanum binti Othman with their research topic, Parents' Awareness of Sugar Consumption and Oral Healthcare of Preschoolers in Sungai Buloh, Selangor.
Assalamualaikum and a very good morning to the honorable panels, professors, doctors, lecturers, and to all dental students. I am Anisha Hanum and along with me Farah Hanani would like to present our elective research project with the title Parents' Awareness of Sugar Consumption and Oral Healthcare of Preschoolers in Sungai Buloh.
Okay, for our background, according to Government of Malaysia's official gateway, preschoolers in Malaysia are children aged from 4 to 6 that begin their education formally as a preparation before entering school system. Children at this age may prompt more sugar cravings when they are growing. They tend to consume a large amount of sugar from their foods and drinks. Based on American Journal of Clinical Nutrition, sugar consumption is normally consumed in form of monosaccharides and disaccharides. Meanwhile, oral health care is the practice of keeping the mouth clean and healthy by brushing and flossing to prevent tooth decay and gum disease. According to American Psychological Association, socioeconomic status is the social standing of class of an individual or group. It is often measured as a combination of education, income, and occupation. In Malaysia, the names B40, M40, and 220 represent percentage of the country's population of bottom 40%, middle 40%, and top 20% respectively. The B40 group has been categorized as the lowest household income group. Okay, from the previous study, there was a relation between awareness level of socioeconomic status of the parents and the awareness level. But in Malaysia, data on the parents' awareness of sugar consumption and oral health care among preschoolers is limited. Hence, the rationale of the study is to evaluate parent awareness of sugar consumption and oral health care of preschooler, specifically in Sungai Buloh, Selangor. Okay, our first objective is to investigate the parents' awareness of sugar consumption and oral health care of the preschoolers, and second, to examine the association between parents' socioeconomic status and the awareness level.
As for the methodology, this was a cross-sectional questionnaire study, a cluster randomized controlled trial investigating parents' awareness level in Sungai Buloh with a total sample of 361. Baseline data collection was conducted between November 2020 to February 2021. Parents that included in the study are parents of the preschool age between 4 to 6 years old in Sungai Buloh. The selected parents are contacted by the preschool principal via their respective group in WhatsApp. They completed a 4-page questionnaire via Google Form. It consists of consent form, demographic data, and 2 other domains, which are sugar consumption and oral healthcare for preschooler. Questionnaire were provided in both English and Malay. For assessment, it consisted of 20 questions on 3-point answer. Score for each correct answer is 2, incorrect answer is 1, and have no idea is 0. Score lower than 13 denoted as low, between 40 to 27 as average, and above 28 as high. Our first objective was analyzed by descriptive analysis and second objective by Pearson correlation. This study has received ethic approval from Research Ethics Committee University Technology Mara on 30th March. As for the result, the study included 126 parents who completed the study questionnaire. Parents each range from 24 to 50 years old with a mean age of 36. The majority of the respondents were 88.1% females and 100% Malay. The overall mean score from this questionnaire is 31.87 score out of 40. The highest score from the questionnaire was regarding the effectiveness of fluoridation into the teeth, the importance of oral health as the health of other parts of the body, and children who sleep with a bottle containing milk can cause cavities. Majority of the parents answer incorrectly or not aware of are regarding brushing their child teeth after every meal, eating 5 chocolate in one go is better than eating in small amount but intermittently, and sticky sugary foods are more harmful to the teeth than sugary drinks. By using Pearson chi-square test, there are significant association between socioeconomic of parents with several questions from the awareness score. SP is less than 0.05. The questions are regarding food and drink that can cause caries formation, sugar content in sweetened drinks, food labeling, the effectiveness of fluoride on teeth, daily frequency of brushing teeth, treatment available for children with caries, and importance of oral health. From this Pearson chi-square test, results show that those with high income have more awareness compared to the other groups. One with ANOVA test revealed that there is a slight difference between the group but not significant in the mean of awareness level of the parents in Sungai Buloh. SP is equal to 0.089 as shown in the table. We observe that T20 group has the highest mean score compared to the other 2 groups.
This study focused on investigating parents' awareness of sugar consumption and oral health care of the preschoolers in Sungai Buloh and addressed a gap in understanding and association of socioeconomic status of the parents with the awareness level score. Based on statistical analysis, parents' knowledge on both domains is a crucial factor and a good determinant that influence their children's dietary intake and oral health care among the 3 groups of socioeconomic. Our respondents were 100% Malay. Based on Department of Statistics Malaysia 2010, majority of population in Sungai Buloh are Malay and Bumiputera. As mentioned earlier, the age of our respondent was 36 years old. Stephen et al. 2005 stated that Generation X consisted of those born between 1961 and 1981 are more productive, more motivated, and easily trainable compared to baby boomers. Statista Research Department 2017 stated that Generation X global mobile internet usage rate is second highest, only behind millennials usage rate. 68.1% of our respondents were female. According to research, both males and females provide parental care. However, females are primary caregivers. Women tend to more concerned than men with monitoring good relationship with their family and friends. There was also significant relation between the mother's oral health education and skills toward their children. From the assessment, we observed that those who have good level of education who access additional nutritional knowledge and information, thus favoring healthy food and being aware about their daily sugary consumption. Apart from that, the parents also may be educated from the advertisement of toothpaste, social media, or reading. Those who lack awareness was usually people who have lack expense. Food with poor nutritional value and higher sugar consumption cost less per calorie and tend to be selected by groups of lower socioeconomic status. Other than that, the misconception may result from inaccuracy information in public awareness. The association between household income and the awareness level presented varied pattern. Different factors may explain this association. Inaccessibility or inaccuracy of information and those who were lower income could be the causes of the lack of awareness among the respondents. Inequalities were observed. Females and those who were higher education level were more likely to have high awareness. For our study limitation, this study was conducted online instead of face-to-face due to COVID-19 pandemic. Hence, we got low response rates. The parents could access to the internet while answering the survey. Repeated requests to accomplish the survey given due to low respondent may be perceived by the respondent as bothersome. And last but not least, limited internet access for some parents.
So in conclusion, the parents' awareness of sugar consumption and oral health care of their children in Sungai Buloh was considerably high. The socio-economic status of the parent does not influence the awareness level as the mean score was not significant. However, our study did not examine the relationship between the parents' awareness level with the oral health status and the prevalence of dental caries among preschoolers. As recommendation, we would like to suggest a further study on relation between parents' awareness level and the oral health status and dental caries prevalence in preschoolers. That's all from us. Thank you for your kind attention.
Thank you very much for Hanani binti Muhammad Rashid and Anisha Hanum binti Othman. I hope you all enjoyed our first amazing presentation. Now, we would like to invite the judges for the Q&A session.
Okay, allow me to ask the first question. Okay, Anisha and Farah. Could you please tell us a little bit more about your questionnaire that you use?
Okay, so our questionnaire were adapted and modified from the assessment of, from the assessment of oral health care, assessment of sugar consumption and oral health care from with the title research of early childhood caries, dietary habits and nutritional status of toddlers and intervention study in Kelantan by University Malaya in 2008. So the modified questionnaire were validated through content validation by by professional expert from our public health and pediatric specialists, and also face validation by target population for the validity and comprehensibility of the question.
Okay, so this the questionnaire actually has been is in Malay.
Yes, we modified.
Provided in English and also Malay.
Both English and Malay. Okay. Out of your respondents, okay, how many percent were B40, M40, and T20?
I'm sorry. Okay, for the B40, as for the household income, 45.2% was M40, 27.8% was B40, and 27% T20.
Does that make up to 100?
100.
Oh, see. Yeah. All right. So, do you think this percentage of B40, M40, and T20 in your group, in your study group, might have influenced the results? Because you did not find any significant difference, right, between awareness and...
Yes. For that matter, okay. For that matter, I think because sorry. for that matter, I think because of we cannot achieve our targeted sample size, as we can only receive 126 respondent out of total sample of 361.
So if the total sample, if you are able to achieve the total sample, would you be able to achieve the same composition at 40%, 40% and 20%? Did you?
I think yes, because from the result that we have get from the study, we can see actually from the mean score the difference between the mean score between the three socioeconomic status, that the T20 have the highest mean score compared to the other two groups, but it was not significant because of insufficient sample size. Maybe if we resume our study and we can get enough sample size, maybe we can see actually the difference between the parents' awareness level with the socioeconomic status.
Yes, because there was the same study was conducted in 2013 in India. There were relationship between the social behavioral and also socioeconomic status with the parents' awareness in sugar consumption and oral health care of the children.
Okay. Thank you. Maybe Prof wants to ask any question? Prof, you're muted.
You're mute, Prof.
Sorry, you did mention that your results shows that the mean score was considerably high compared to the other studies. So why do you think that is so?
Sorry, Prof. The parents' awareness level. Oh, the
Yeah,
mean
in
score
your
of the
conclusion,
overall.
can you say it was like really high compared to previous, reports? So why do you think that is so? What's the contributing factor?
Oh, I actually from from the conclusion, we did not compare our mean score with the other study. For
So why did you say it was considerably high based on?
we
comparing it
before
to what?
depends on the score range.
Usually in other reports, the one that you have read, what were the scores? What were the scores like? Like the one in India that you quoted, what was the mean scores of that awareness?
It stated
I
that
think,
the study from the India is stated that 73.8% of the mother have a good knowledge in the dietary practice, but only 27.1% of mother has knowledge about the oral health care. So based on our research, we conclude that in Malaysia we have quite considerably high of awareness of the parents.
So what was the percentage again? Your percentage, your mean score in comparison to India?
Percentage. Sorry. Ours are 79.68 compared to India.
So it's about the same, no? 70s, in the 70s?
It's quite the same. It's quite the same because ours we compare both oral healthcare and sugar consumption. We compare it both, but in India they separated it because they said that 73.8% only for good knowledge for the dietary practice, but 27.1% for oral healthcare.
All right.
So
Okay.
it's quite
Thank
low
you.
for the oral healthcare.
Okay. Thank you.
Thank you, Prof.
Hey, thank you. Just one quick question, or rather comment. It's always good to have a comparison in order to give a better statistic value. And then the geographical region is again, it's another limitation when you compare with a region such like India. I'm not sure what's the sample size of the India, and the study of the what kind of socioeconomic background they choose. So you need to compare those as well to give us a good comparison. And is there any available program for the awareness from our side, UiTM? Do you all have any? Is there any that you reach out for the same reason, for the awareness of the oral hygiene? And are there any programs available for the increasing awareness?
For now, I don't think that we have that specific for specific program to raise awareness, but we just when the parents come to our clinic, we just a regular advice is given to the parents accordingly, but there's no specific programs for this. But we can actually
something to think about,
do
yeah.
do
From
an
the student
initiative
side,
or
you can
intervention
create
program.
an
Yes.
awareness program. While you're doing this program to find out the same thing you can do to do the awareness as well, increase
Yes.
awareness among the population as well. Thank you so much.
Can
Thank you so much,
sorry,
Professor.
Can I ask one more question? Sorry, yeah.
Yes.
Okay.
Yes, Prof.
Can you explain a little bit about the RCT bit? Because you said your study is an RCT, right? Randomized control trial? Is it not?
Cluster random. We do a cluster randomized control trial.
Yeah. Because
or
I
why
think you did not explain about the how you do the randomization and how the flow of the study was not really clear in your presentation. Just a short one, it's okay.
How we recruit the parents,
And
etc. Like that.
how you conduct the RCT.
Oh, okay. We actually, okay, for our study, we recruited 10 preschoolers in Sungai Buloh. Okay, from there, the selected preschool parents were contacted via their principal via WhatsApp, and then we from there the questionnaire and also the informed consent was obtained from the Google form. So we do it on online platform.
Yes, because at first we want to do it face to face, but due to the pandemic,
that's how you recruit. But the RCT bit,
RCT, RCT meaning that the reference targeted population ke? How we select the parents. I'm sorry.
How did you divide them into groups and all that? Did you do that? Or is it not an RCT?
Because inside the questionnaire we have stated that the parents, the only parents that required to answer this questionnaire is only the parents that have have children aged from 4 to 6 years old only.
Yeah, but you're sending it to a preschool. Of course, they have children 4 to 6 years old, no?
Oh, yes. I'm so sorry.
It's okay, both of you. Okay, thank you.
Thank you so much.
Time
Thank
is
you so
up,
much,
right? Okay, thank
Prof.
you.
Thank you very much, judges and presenters, for answering the questions and for the presentation. Before we move on to the next presentation, we'd like to present the e-certificates for the presenters for your participation in this symposium. Moving on to our last oral presentation by Muhammad Akmal Munir bin Ayub and Jamila Sakina binti Muhammad Jasin, who will be speaking to us on the comparison between digital panoramic radiography and cone beam computed tomography in measuring pre-surgical dental implant vertical height at posterior of mandible.
Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to our respectable judges and fellow audiences. My name is Jamila Sakina binti Majasin, and along with me is Muhammad Akmamuddin bin Ayub, and today we will be presenting our research entitled comparison between digital panoramic radiography and cone beam computed tomography in measuring pre-surgical dental implant vertical height at the posterior of mandible, supervised by Dr. Muhammad Herman Suparman and Dr. Nur Hidayah Redwan. Our presentation today will be consist of background, problem statement, objective, methodology, results, discussion, conclusion, and also references. To start off with our research, a thorough pre-surgical implant assessment is one of the determinants that contribute to a successful dental implant placement. The assessment usually includes evaluation of trabecular bone dimension, quality, surface topography, and the relationship of proposed implant site to the anatomic structures such as nerve, blood vessels, adjacent tooth roots, nasal floor, and maxillary sinus. In order to achieve a long-term treatment success, Ozak et al. Mentioned that panoramic or pan-radiography and cone beam computed tomography or CBCT have been reported to be the most frequent imaging modalities that are available in the market for treatment planning of implant placement. Pan-radiography has been used as a gold standard for implant assessment for quite some time, as its main advantage is the ability to display body of the mandible and maxilla, mandibular canal that contains inferior alveolar nerve or IAN, and maxillary sinus in a single image. According to Hu et al., pan-radiography allows identification of suitable implant site, measurement of the residual bone height, determination of the length required, and mesodistal angulation of an implant for pre-surgical planning. As for CBCT, it is one of the advanced imaging modalities in the dental field that produce detailed and high-quality 3D images of hard tissue structures. Angelo Paulus et al. Reported that CBCT images enables clinicians to assess the bone as it can produce a clear 3D images of highly contrasted structures with corrected magnification, which will be helpful to obtain an accurate measurement in pre-surgical implant assessment. It is also has lesser radiation dose as compared to conventional CT scan. Thus, this will reduce the radiation hazards as mentioned by Kumar et al. However, having said that, both have their own limitations, such as in panoramic radiography, it provides a horizontal and vertical plane magnification and also unable to display the existing bone width and their precise association with adjacent anatomical structures. While for CBCT, although it has more advantages in pre-implant assessment, it is not available in most dental clinics due to the cost, where it becomes a question whether pan-radiograph is adequate as pre-operative imaging modalities before proceeds with dental implant treatment. The problems that arise from these two imaging modalities will restrict the oral surgeon from performing an accurate pre-surgical implant assessment and lead to a wrong placement of the implant, followed by injury to the inferior alveolar nerve or IAN in the mandibular canal. According to Al-Juburi et al., there are 40% incidence of IAN injuries that cause serious complications to the patient, such as the nerve might be stretched, compressed, and partially or totally transected, which commonly resulted with temporary or permanent paraesthesia or anesthesia of the teeth, lower lip, or surrounding skin and mucosa. Despite what has just been said, Shahidi et al. Mentioned that an accurate alveolar bone height measurement and a safe margin distance from vital anatomical structures such as mandibular canal are important factors in dental implant placement for pre-surgical planning phase. Therefore, the objective of our study is to evaluate the reliability of pan-radiograph in comparison to CBCT images for posterior mandibular pre-implant assessment. Moving on to the methodology of the research, we have conducted a retrospective review of the PAN and CBCT images of posterior mandible that include inclusion and exclusion criteria in patients with fully or partially edentulous and dentate on 66 patients that consist of 19 male and 42 female for pre-surgical dental implant assessment between July 2016 and December 2020 at the Diagnostic Imaging Unit, Faculty of Dentistry, University Technology Mara, Sungai Buloh campus. The measurement was performed by dividing posterior of mandible into two segments, which are anterior and posterior of every obtained PAN and CBCT images. Anterior region was categorized from the mesial part of the first premolar to the distal segment of second premolar, while for posterior region was from mesial part of the first molar to the distal portion of the second molar. Then, average mesodistal coronal dimension from each region will be measured for both sides as the midpoint. I like to bring to your attention that in fully or partially edentulous patient, the location of the teeth will be simulated with respect to the location of the mental foramen. So, if one tooth is permanently missing at any of those regions, the midpoint will be obtained by dividing the total measurement from one part of the crown of available tooth to the nearest part of the crown of the tooth adjacent to the missing area, as you can see on the left side of the image. However, as shown on the right side, if more than two teeth were permanently lost at any anterior or posterior region without presence of teeth distal to the area, the measurement will be obtained by using standardized measurement of each region as reported by Male et al., which are 14.4 mm and 20.6 mm respectively, and mental foramen will be as a midpoint reference point. For measurement of vertical bone height, the reference point was established from the upper crest to the superior border of mandible canal. Therefore, the measurement will begin at the midpoint of total mesodistal coronal dimension of each region from the upper crest to the superior border of the mandibular canal. All measurements were independently performed by 3 observers that includes 2 dental students and 1 oral radiology specialist. It was done by measuring 3 times on each imaging modalities, and average readings will be calculated, and once the average readings were determined, mean difference in measurement between pen radiograph and CBCT for each patient were then calculated.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to everyone. My name is Muhammad Akmal Munir bin Ayub, and I will continue with the remaining parts of the study. In our study, the most frequently observed gender was female, which made up 64% of the total samples, whereas Malay recorded the highest observed race with 88%. All 66 sets of pen and CBCT images were assessed in the study. In pen radiographs, the mean vertical bone height measurement at each region were higher as compared to CBCT images as shown in Table 1. Moving on to the next one. A two-tailed paired t-test were carried out to compare the mean difference between pen and CBCT images in measuring vertical bone height at the posterior of mandible. All the 4 regions yielded statistically significant difference in mean vertical bone height measurement between the 2 imaging modalities with a p-value less than 0.01. To assess the relationship between pen and CBCT images in measuring vertical bone height at posterior of mandible, a Pearson correlation coefficient was computed, and the results demonstrated a very perfect correlation between the 2 imaging modalities at each region, with the R value ranges between 0.86 to 0.92 with p-value less than 0.001. Agreement between 2 examiners, who were 1 undergraduate dental student and 1 oral and maxillofacial radiologist, in measuring vertical bone height at posterior of mandible using pen and CBCT were assessed using intra-class correlation coefficient (ICC). A two-way mixed effect model based on absolute agreement were assessed in the interactive reliability with 95% confidence intervals reported for each ICC. The results showed excellent agreement between the 2 interior examiners with p-value less than 0.001. Now, moving on to discussion part. Our study found minimal difference between pen radiographs and CBCT images during the quantifying of vertical bone height from the alveolar crest to the superior border of mandibular canal. This is supported by a study from Ozab et al., where there was a range of 0.36 mm to 0.76 mm in average difference between pen radiographs and CBCT. Besides, comparison of the contralateral segment of the posterior mandible resulted in no significant difference in mean difference between pen and CBCT. This may indicate reliability of both pen and CBCT images in evaluating the respective contralateral segment of the mandible. Furthermore, a good prognosis dental implant should not interfere with the mandibular canal, where inferior alveolar nerve runs through. According to Vasquez et al., a safety margin of at least 2 mm between the tip of dental implant and the superior border of canal in pen radiographs is adequate to determine an adequate alveolar bone height prior to posterior mandibular implant insertion. Similarly, a study conducted by Gelak et al. Suggested when using CBCT-based data for pre-implant surgery assessment, a safety zone of 1.7 mm should be taken into consideration. Correlating those studies to ours, once surgeons obtain the vertical bone height measurement from the alveolar crest to the superior border of mandibular canal, measurement should be deducted by 2 mm in pen radiographs and 1.7 mm in CBCT to avoid any injury to the nerve. In conclusion, the idea of sufficient information provided by pen radiographs for pre-surgical implant assessment in routine cases or when no CBCT is available at the clinics is supported by this study. The results from this study also suggest pan-radiograph is a feasible and cost-effective imaging modalities with the added advantage of reduced radiation dose to the patient. However, currently, CBCT remains as the best imaging modalities for assessment for pre-surgical implant due to the reason that CBCT has minimal magnification errors. So these are our references. And with that, we thank you.
Thank you very much, Muhammad Akmal Munir bin Ayub and Jamila Sakina binti Muhammad Jasin for the great presentation. Now, we'd like to invite the judges for the Q&A session.
Okay. I just want to ask, how do you ensure that you are measuring at the exact location on the pan radiograph and on the CBCT? When you measure the vertical height, how do you ensure you are measuring it at the exact location on the panoramic radiograph and on the CBCT?
We can't hear you. Your mics are mute.
Hello, can you hear me?
Yeah.
Actually, we did the measurement 3 times for each imaging modalities, and then we will do the inter-examiner reliability test to ensure that we were in the safe vertical measurement.
So when you choose the spot to measure,
Mm-hmm.
each of you independently choose the spot of the other, or you, the three of you, sit together and choose the spot where to measure?
No, we have established how to measure it, which are first we measure the average mesiodistal coronal dimension of the crown, and then that will be as our midpoint, and then from that we will measure the vertical bone height starting from the midpoint of the crown, and we will measure the vertical bone height from the alveolar crest to the superior border of the mandibular canal at the midpoint of the crown.
Okay, but the magnification of the pan and CBCT is different, right? You stated that in your conclusion, isn't it?
Yes, Prof.
Yeah,
So
yes,
how do you ensure that the calculation too is the same? The mesiodistal width is the same. Mesiodistal width of the tooth on the pen and on the teeth are the same. I mean, you don't use any markers, right? Because these are retrospective radiographs. You don't put a marker so that you will be the same when you take panoramic radiograph or when you take CBCT.
It doesn't necessary to have a same measurement between pen and CBCT, because in our study we want to check whether there are differences between pen and CBCT in measurement, and it shows there are mean difference between that. So
But if you want to measure the same place, isn't it? You want to measure something, you want to make sure you are measuring the same thing.
yes,
right? You want to measure the same spot. Then only you can meaningfully compare. If you choose a different location and I choose a different location, then we compare, it doesn't make sense. Did you understand my question?
Yes, Prof.
You don't show any images of the CBCT, right? How you select the spot to measure the
we include
dimension?
in our we include in our methodology just now. The bottom
But I
one
don't
is
see
our
any 3D images of the CBCT. How do you measure on the CBCT? Which slice did you measure or did you choose?
We're using the curve slice and we do the panoramic
The
reconstruction.
axial slice or sagittal or coronal? Which slice of the 3D CBCT image that you measure this vertical height from? You know, when you have CBCT images, it comes in different slices, right? You have views, axial views, sagittal views, coronal views. So which view did you measure this from? It's okay. It's okay.
We use our in panoramic reconstruction for our measurement in CBC.
Oh, okay. So you use 2D measurement. But why? Why did you use 2D measurement when you use 3D tools?
Actually, we use the axial cross-sectional, and then we reconstruct the into panoramic reconstruction.
Okay, thank you.
Okay, just one quick one. I'm not very familiar with the procedure as Prof. has already mentioned, but just isn't this procedure dependent on the skills and the experience of the dentist, the surgeon who's working on? Is it does it the skills and the experience of the dentist plays any role in handling both this different imaging?
Yes, doctor. I think we need a skillful dentist to handle these two imaging modalities in order to ensure a good pre-surgical implant assessment.
So that could be one of the parameters in influencing your outcome, right? Doesn't matter much. Maybe a more experienced one will be more comfortable with the pen than the CBCT or vice versa, is it? The skill levels, I'm just saying when you compare, the skill levels also plays a big role there, right? There's a lot of parameters like just now Prof said to measure, to look into. Probably those, it plays a important role in the sense like if you have how many years of experience working with this tool and how to read those and applying in your implant. I think that's also a
Yeah,
very important aspect.
actually, we are trained by our oral radiologist before we start to do the measurement on both imaging modalities.
Right, thank you. So Haslina, any questions from you?
Question at Taslina? Okay, so no further questions. Okay,
Thank
you.
Thank you, judges.
Thank you.
Thank you, judges, and also presenters for answering the questions and for that wonderful presentation. Next, we will present the certificate of participation as a thank you for your willingness to contribute towards this year's scientific symposium. Thus, this marks the end of the oral presentation for this year's symposium. Thank you all for attending. We hope you have learned and enjoyed the presentations. It is our pleasure to have you with us. We'd like to remind you there are several programs still ongoing, so stay tuned on the symposium live telecast YouTube channel on our website. At 10:30 a.m., we are having the Special Care Dentistry Innovation Competition. Later at 2 p.m., please also join in on our plenary talk by Professor Dr. Yongguk Park from Kyunghee University, Korea, and followed by the closing and awards ceremony. Once again, thank you and we wish you a great day ahead.
someone else who loves me like you used to. Sometimes we're not ourselves. There's no one I can turn to. And I know all the feelings that we shared are in the past. And I know your relationships are never meant to. And I'll take
Great music. Good music. So I can hear. Okay. So I see my face in the pixel. Okay. All right. So did you see me? Uh, I just put my phone down and then just let us communicate by WebEx. Okay. 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 Hello.
Hi, and welcome back to the afternoon session on the last day of our first 11 UiTM Dental Student Scientific Symposium. Before I introduce our honorable speaker, I would like to make a housekeeping announcement. All participants are encouraged to post your questions in the chat box. Moving on, it is our pleasure to have Professor Yongguk Park with us this afternoon. Professor Yongguk Park is a world-renowned researcher, author, and speaker in the clinical orthodontics and basic science of craniofacial biology. He is the professor of orthodontics at the Kyung-hee University School of Dentistry, Seoul, Korea. He is the immediate past president of the university after his positions of the provost of the university, the dean of the School of Dentistry. He is the counselor of the FDI World Dental Federation since 2017. He is the past president of the KEO, Korean Associations of Orthodontists, and its associate foundation, KEOF, and the immediate past president of the Korean Academy of Dental Education. His main interest lies in the lingual orthodontics with individually tailored appliance system and accelerating tooth movement with corticism, which was developed and given its nomenclature by himself, involving minor periodontal procedure without flap elevation and like accelerated orthodontics with LED. He was the visiting assistant professor of orthodontics at Harvard School of Dental Medicine and Faculty of Dentistry, UiTM, and is currently the guest professor of the Osaka Dental University, Japan, and Dalian Medical University, Dalian, China. Professor Park has wide experience and already made numerous publications. Without further ado, we welcome Professor Yongguk Park to share his presentation titled Narrative Medicine, Communication Skill to Facilitate Listening and Empathy.
Hello. Do you hear me? Hello.
Yes, Prof. Yes, Prof. We can hear you.
Okay. So let me begin my presentation today.
All right.
Okay. Good afternoon. My name is Yongguk Park. I am from Kyung University, Seoul, Korea. It is great honor for me to be a part of Dental Student Scientific Symposium, and I wish to extend my highest respect to the Dean, Professor Ibrahim, for his invitation and also to all the faculty members of UiTM School of Dentistry. UiTM and my school have sister relationship since year 2016, and I am very happy to get back to you by online platform. This photo was taken during the conference of IDCMR, International Dental Collaboration of the Mekong River in 2016. And this is Professor Mariatti and Didasor. And at the time, we also had a conference with the orthodontic graduate students. This is Professor Mariatti and Professor Raina Hafiza Norman. I wish to begin my presentation with a fundamental and a humane question to all of us, which is who I am. Does my occupation represent my identity, who I am, my educational background, how much I have, how many people I know, how pretty I look, how smart I am, how old I am? Do all these explain who I am? How can I figure out who I am? Does my working environment reflect what I am? And am I satisfied by that? Am I good with people around me? Do I understand and control myself well? Do you feel the people around you keeping happy life? Have you ever heard Johari window? I think you have heard Johari window before. The Johari window is a tool that helps people better understand their relationship with themselves and others. There is 4 parts in our personality. I have my own personality that I know and you know. And also, I have some aspect of my personality that I know, but you don't know. And also, there is some aspect of my personality that you know, but I do not know. But there is certain aspect of my personality that nobody knows it. And then even I do not have an idea who I am. So this is called unknown window, like passive relationship, or my stubborn personality, my subjectivity, or negative attitude. So what about your school? Just think about our schools. Probably you may be in fatigue, or we have some conflict day and night, or even conflicts between same gender in workplace is more stressful. And then for the students who are exposed to clinical settings, have sometimes complaints from patients. So especially for the final year of dental students, our common working surroundings involve cabinet, which is full of materials. Probably we have case obligation, we have tough homeworks and team tasks, or sometimes we have some issue with our colleagues or house staff. And then sometimes we have unmanageable patient occasionally. But anyway, we are dentists in near future. If we want to live professional life, of course, we are supposed to get married and we are going to have family. As far as we are supposed to get married or we are going to have family, we are facing the issue of nurturing, education of children, social activity respectively with spouse, or sometimes indifference of spouse, and we may have some health issue of ourselves, our spouses, our children, or our parents. So we must be professional who dream success socially, or we are the one who wants to build happy family. And also, we must be human being who weighs between social success and personal happiness. There was interesting book published the year 1992, which was written by John Gray. The name is Men Are From Mars, Women Are From Venus. So these two couple has conversation, and she says, Casper, look at that big bomb. So think about the bomb. it is quite different. The bomb for her, it means him. And for him, the bomb means her. So the origin of the difference in communication between men and women is going back to hunter-gatherer society, which is probably more than 20,000 years ago. When the man was hunting in the field to make food, they have to communicate, to share information. For example, look at 3 o'clock direction, there is a rabbit. And then their communication should be very short, very informative, and then very distinct. In the meantime, the men were hunting in the field. The women remains in the shelter, gathering some vegetables in the field, and then they are likely to have more opportunity to act together, to behave together with the neighbors. So they need to avoid some conflict, some friction each other. So their communication should be something relationship oriented. So these two are quite different in terms of communication. For the attachment, the male's attachment is for interpersonal. In the meantime, the female attachment is more expressiveness or emotion control, emotion exposure. So men have tendency to receive recognition, support, encouragement, compliments from others. In the meantime, the female has tendency to receive attention, empathy, respect, and devotion. So this is a small joke. For the boy, for the man, how to make a conversation with a woman successfully. This is joke. The first thing is just to repeat the last words of female. For example, when female says, I bought brand new bag yesterday, and then for the man, you have to say, did you buy the new bag? Or when female says, I met Susan on the way here, and then never say, and so what? Never say that. You have to say, did you meet Susan? So the best way, if you think it's bothering to repeat last words, then you just speak the interjections. For example, when your woman says, I bought brand new bag yesterday, and you said, really? Or when your girlfriend says, I met Susan on the way here. Susan, oh my goodness. That's more than enough. So the words men should remember before beginning to talk woman is 3. Really? Awesome. What? This is joke. Of course, there is some type of communication between parents and children. It might be open positive or closed negative. The difference between these two types of communication between parents and children result in the difference in family unity, social adaptation, self-concept, and self-esteem, and also the self-control and, of course, mental health. So the objective of communication is definitely to build relationship. The build relationship involves physical and emotional intimacy between subject and correspondence, which in turn means myself and yourself. And all the other is something external, which is called it or that. So I and you is humanized relation, and we can make dialogue. So I towards you in relationship in which the other is not separated by discrete bounds. But I and it or I and that is non-humanized. It is towards an object that is separate in itself, which we either use or experience. You may read this book, Little Prince. There's very good a quote in this book, which is, it is the time you have wasted for your roles that makes your roles so important. So for building relationship with correspondence with you, you have call him with your own voice and words. I think you may watch this movie, Eat, Pray, and Love. There's some words in there, my words, my life aspiring to inspire you, which means So building relationship is one of the way is taming, which is of willingness, of no exception, of no compelling. So for the best relationship, I have to change myself if I want you to change. And I have to accept just the way it is, or I have to love it. So there is some obstructions in communication and building relationship, which means prior moral judgment, criticism, compliment, psychological diagnosis or prejudice, comparison or competition, justification, denial of responsibility. All these are obstruction in good communications. So every message should have connotation for appropriate communication. If the message does not align with connotation, there is confusion or conflict. So all these, I put the name narrative medicine, which means it's the communication skill to facilitate listening and empathy. So you are going to be a dentist, but sometimes your words is a little bit different from patient's words. So I put it name dentist from Mars, patient from Venus. In Korea, we have a movie. The name of the movie was Blood Rain. And then one of the quotes from this movie has something negative perception from the public to the healthcare provider, which means to the doctors, which is, do you think you live prosperously because you have this medical skill that you are so proud of? No, it's simply because human lives are such a tough and chewy. So the general perception towards healthcare givers, I mean the doctors in industrialized society involves they are unfriendly and miserly. They are too selfish. The doctors are too busy. The doctors are too impatient. The doctors are too uncaring. Or the doctors make too much money. So what about dentists? What about the public perception towards dentists in industrialized society? Is there any big difference? Well, let's see. In industrialized society, European countries, United States, or I think I have no idea in the situation in Malaysia. In my country, I think the dentist has some impression that they might be flirt. We have another movie, which means Dr. Bong. And then this is a synopsis of the movie, Tom Care Dentist. Dr. Bong, who lives with his 5-year-old son, has uncountable girlfriends. Another movie. And then the synopsis of the movie appears like this. This is comedy, that a woman dentist has something with such a nice guy, which means this is nice guy, and this is woman dentist. And then this is nice guy. So the nice guy is not going to have something with dentist, which signify that dentist might be the bad person. So I tried to review some literature. Land published a paper in year 2000, and then there is description. Dentists are considered impersonal in their approach to patients, preoccupied with technical aspects of treatment to detriment of personal touch. They see you as mouth was frequent comment. Commonly expressed the view of dentists as being highly paid, motivated by earning potential and therefore operating a conveyor belt service, seeking to treat patients as much as possible or as fast as possible to make more money. And also we have something, Schweitzer syndrome. And then Dr. Schweitzer used to be a doctor who made free medical service in Africa. So after the Schweitzer, the public in my country considers free service of doctor as best of virtue. And then this comes in negative environment for establishing the role model for health professionalism. So this type of negative social recognition towards healthcare professionals probably came from immaturity in communication skill and establishment of human relationship. So at this time, we have to think about our communication patterns. Communication, the origin of this word, com, means get along or share. Uni means one. Kate means become. So communication means becoming one by getting along. We have two types, Donald Trump and Hillary Clinton. Who is better communicator between these two people? Well, the answer is in your side. So the purpose of communication have two aspects. One is information sharing or relay informations. Second purpose is establish the rapport. So anyway, the core of communication is give ear and make an empathy. Give ear means give ear to someone or be all ears to someone. And then, of course, hear and listen is 100% different. Hear means for sounds that come to our ears without necessarily trying to hear them. But, listen is paying attention to sounds that are going on. So all these are for empathy. So the empathy is core value of healthcare communication and creation of conditions for patients' psychological stability. And then empathy, this is, or a communication skill is intellectual skill. It's management skill of emotion. This is not innate talent. This is acquired by learning. So this is the reason why we have to study communication skill. So why give ear and empathy? Because we have to establish rapport between doctor and patient. So 3 words of communication in real life involves give ear, establish empathy, and then establish a rapport. So understanding the give ear and rapport. I mean, this is one of the movie which was 20 years ago in the United States, American TV movie. I hope you to see this movie for a little time.
Name?
My name. Vivian Baring.
Huh?
Baring. B-E-A-R-I-N-G. Vivian. V-I-V-I-A-N.
Doctor?
Yes, I have a PhD.
You're a doctor?
Oh, Dr. Harvey Kalikian. Name? Lucy, Countess of Bedford.
Do you think the doctor in the movie is good communicator? I don't think so. What is main problem for the doctor in that movie? He doesn't make any eye contact to his patient, right? And then he is insincere. Anyway, the giving ear and the empathy in healthcare means make patient to speak what she or he wants to speak in her or in his own perspective. And then it is to respect and accept patient emotion, and it is to accept patient's aspect and professional opinion. So this is called narrative medicine, which means to understand in patient viewpoint how they are affected in everyday life by illness and how they perceive their situation by illness, and contrastive concept against conventional aspect of healthcare, defining and understanding illness. This is
I think so. What I like best. No, I mean, it's not the same. It's like it's out of control, isn't it? I'm scared. Of course you are. I want to. I don't feel so sure of myself anymore. Oh, you used to feel sure of me, didn't you? Yes, yes. I used to feel sure. Oh, baby, it's okay. It's all right. And it hurts. I know. It's all right. It's all right.
So how do you feel the communication type of this nurse? She expressed her empathy. She is giving console. She's very good communicator. I think you have the same impression to the nurse in the movie, right? And so the elements of narrative medicine involves at first listening, and then have empathy, and then reflection, rapport. Let's compare between conventional medicine and the new narrative medicine. So in the new narrative medicine, everything is illness-centered instead of disease-centered. And then patient tells a story and doctor is listening instead of doctor is questioning and patient is answering. So doctor should be listener instead of doctor to be a questioner. And then patient leads every conversation, and then everything. The theme of the story is in the patient viewpoint instead of doctor's viewpoint. So, and then the story should be subjectivity instead of objectivity, and then everything should be in the emotional background. And then this is coming from social psychology instead of science or biology. So we have to be self-experienced professional instead of healthcare professional. So these are quite different. So the advantage of narrative medicine involves customized care by understanding and empathizing patients' social and psychological factors and environment, and relieve the scrupulosity towards caregiver, and release the complaint that caregivers may miss to listen to what patients really wish to talk, and improve the communication skill to care patients by in-depth understanding of patient aspect, and establish rapport by respect and empathy on patient's own personal and emotional aspects. So efficacy of narrative medicine are having an opportunity to reflect who we are, and then likely to shift the meaning of existing experience to different one through dialogue. For example, negative, oppressive past history can translate to positive one. And also can get rid of specifically problematic and traumatic elements by selection of meaningful events and living as positive one in life history. So the efficacy of narrative medicine also involves we can notice our own hidden emotion by emerging feeling in the course of narration, and we can establish rapport by solidarity, empathy with others, and we can reduce the burden of unfortunate experience by acknowledgement of same situation of the others. So the good listener, the listener expert is the only one who can read the critical clues of important changes related to the patient. So the listener is the only one who can read non-verbal clues clarifying the ulterior meaning of the words. So we have to catch non-verbal clues instead of verbal. This is good listener. So premises of good listening is to think what the opponent, what the other is going to speak will be meaningful and interesting. And then willing to make complementary modification by listening, accept and respect the opponent's desire to speak, try to commune regardless to authenticity. So two pillars of listening attitude is facilitation and feedback. Let's look at the facilitation. We have to express our facilitation response. For example, expression of understanding, such as, yeah, or nodding. Or we give interpretation to the patient. Oh my God, how come? Or sometimes we have to encourage the patient to speak more. For example, and then, and what's up next? Or we just do echo the patient's words. And also, second thing, very important, is we have to give feedback to the patients, to our speaker. For example, the interpretation, paraphrase, summary, question related to speaker's words. So the function of the feedback involves for the patient is good for a sense of being listened. It's going to give patient the sense of attracting attention. And then it is good to verify if caregiver knows patient's opinion, and opportunity to add what the caregiver misses, or we can fix the error, whatever caregiver misunderstands, and let patient to explain the problem and his own opinion. And for the doctor's advantage involves maximize the accuracy of information, foundation of mutual understanding, re-examine the found fact, and clarify uncertainty, recall the information, and demonstrate that the caregiver pays attention to patient's physical condition as well as personal status. So what is empathy? Empathy is to understand or to feel what the another person is experiencing from within their frame of reference. That is the capacity to place oneself in another's positions. And then it is to understand patient emotion of anxiety, frustration, desperation, and cope with them actively in healthcare. So we have to focus this slide very carefully. The core of the empathy is let the others know my state that I feel and support the way the others do and have a solidarity with the others. So the core of empathy is beyond the capacity to understand and share the feeling of another. Empathy, the core is expression of my own state of empathy to you, to feel and resonate my empathy. This is very important. So type of empathy involves topicalized emotion, support to specificity, justification, express empathy, reassurance, give hope, console, respect, advise, and support. There's some papers published by Honeth in year 2011. And self-identity is formed interactively by recognition of impression or expectations of others from childhood. Self-identity is formed in relationships with others and becomes effective when recognized by the others. Mutual recognition, the precondition of life, and the source of self-identity is coming from interpersonal communication, particularly from narrative dialogues. So what about inadequate communications? If we lose the trust of patients, if we give negative influence to the patients, this comes in the loss of confidence and destruction of the rapport. So when the patient dissatisfaction is coming from, probably it's from real bad result or from imagined result or from unrealistic expectations. So anyway, this type of inadequate communication result in dissatisfactions. So inadequate communication such as defensiveness, arrogance comes to disappointment of patients. Sometimes it's going to provoke patient anger, frustration, or reactive hostility. This type of insincere, half-hearted, or belated apology comes in, result in exacerbate conflict. So what is good qualification for a good communicator? It's positive self-concept. It is adaptability, emotional controllability, interest in human relation, expertise, exemplary lifestyle. So difficulties of healthcare or communication is that it doesn't mean for the others to listen to you when you say. And it doesn't mean for the others to understand you even when they listen to you. It doesn't mean for the others to agree to you even though they understand you. And it doesn't mean for the others to remember what you said even when they agree to you. And finally, it doesn't mean for the others to behave even when they remember. So the obstacles of communication is coming from frequent mistake of arrogant reactions to understand already. Oh, I know that, I know that, I know that. This is very bad. Or professional wordings or nonverbal communications, lack of nonverbal communication such as eye contact, a very comfortable environment. So, and obstacles of communication involves wrong habits, one-sided conversation, forcing their own logic to the others, ignoring others' feeling. What is patient expectation to us, to dentists? I try to find some article about this, and then it comes out like this. People feel better. Dentist-patient communication would allay their anxiety. And patients estimate dentists with a favorable interpersonal relationship have a better clinical competence. And then higher patient satisfaction to dental services appeared in better interpersonal and communication skills. Favorable interpersonal and communication skills pull up better patients' reliability. Good interpersonal competence and communication skill lower the risk of legal conflicts. So I just tried to wrap up, and then good personality for a good communicator involves friendliness, personal touch, caring, gentle, and reassuring.
So, the young doctor, like the senior scholar, prefers research to humanity. At the same time, the senior scholar, in her pathetic state of simpering victim, wishes the young doctor would take more interest in personal contact.
Yeah. So what is communication? I wish to say that communication is interests in human being and our own lives. So what is health communications? What is healthcare communications? It is the showing the utmost courtesy for the human being in sickness. So my final words to transfer to you is everyone who willingly enters into the pain of stranger is truly remarkable person by Henry Nguyen in memoriam. So this is final slide of my presentation. I just want to make a presentation of one very short movie clip that the type of communication is so important. Let me find my slides for that. Okay, this is.
Now, whether it's a coffee shop or any store for that matter, we've all handed money to a cashier and gotten change in return. If, however, they give us too little change, we're going to notice and we're going to say something. What happens if they give you too much change? Do you let them know? Or do you keep that little accounting error to yourself? Let's find out. We've set up a hidden camera experiment in this local coffee shop to put morality to the test. We've enlisted Brain Games actress Marlena to work behind the counter. She'll deliberately give unsuspecting customers way too much change. In the case of our first customer, an extra $20.
22, 25. Right, and it'll be ready in just a minute.
What would you do? Let's see if this customer does the right thing.
22, 25.
Just looking around.
She definitely gave you back $20 too much.
This woman's morals were strong enough to resist the $20 temptation. But do you think most people will pocket the extra money? We run the experiment for more than an hour, and every single person gave the money back. You would do the same, right? People are so nice. Let's see what happens. Jason lets the customers in on our experiment. Sorry to surprise you. That's
money back.
so. What crossed your mind in that moment?
I'm a bartender, so I understand if she gives me too much, her whole bank is messed up. So
We run the experiment again, but this time we make one adjustment. We transform Marlena from a sweet angel into a rude, distracted barista.
well, what do you want? Like, just one. Do we even do that? Wait, you wanted what?
If someone with a bad attitude gave you too much change, would you tell them? Or would you keep the cash? Let's find out what customers will do now.
How many splinters?
4 splinters.
4?
All
Alright, do we even do that?
Look at his reaction.
This guy's got a sweet tooth, but Marlena's behavior could be leaving a bad taste in his mouth. Do you think he'll tell the truth or take the 20?
Oh my god. Guys, I need to take a break, okay? I just,
He's really good at being obnoxious, huh?
there you go. I'll be right back.
Without a moment's hesitation, this customer pockets the extra cash. Now, what about this guy?
Just a second, okay?
You okay?
Yeah, just to be really funny. Wait, I'm so sorry. Wait, you wanted what?
Americano?
Americano. Okay.
What do you think he'll do?
20, 30, 35, 36, and 49 cents. Thank you. It'll be right back.
Look at him. He's looking at it. He's counting it. He's realizing it. He gave her a tip. He's keeping the money. Thanks.
No problem.
Cheers.
Since we instructed her to be rude,
Just as a note to you, just working your attitude a little bit.
we now
Okay, this is the final of my presentation today. And then, so this movie clip signifies that the type of communication is affecting the response from the other side of our conversation. So we have to be very, careful when we communicate with our patients. So this is the final slide of my presentation. Thank you for listening today. And then I'm very good to see you again and get back to UiTM, my homeland again. Thank you.
Thank you, Professor Park, for the eye-opening sharing session. So for now, we have reserved a questions. So I'll read the questions. All right, so the question is from Dr. Amiza Rajali. So the question is, what is your opinion regarding influence of COVID-19 situation with how we interact and communicate with our patient and also students?
What is the context of question? There is many aspects of COVID-19. And then, so what is the aspect of question? Can you explain
All right.
that, please?
Yes. So the aspect is, since we are now in the pandemic of the COVID-19, so what is your opinion, Professor opinion, regarding the influence of how we interact and communicate with our patient and student in this pandemic?
For me, we have pandemic situation years ago. So the pandemic comes up to us very suddenly. That we are going to leave type pandemic disease forever forward. So this is called endemic instead of pandemic, which means we live together with the virus. In the meantime, we anticipate their communication or interacting pattern with dentists and the patients will be quite different from a previous one. From previously, we talk to our patient in a close distance without any PPE, personal protection equipment. But at this moment, we wear very heavy masks. We wear head cap, and then we wear, a shield. So I think this type of physical personal protection and equipment is something psychological or emotional barrier between dentist and the patient. So probably when we talk to our patient and patient talk to us, there might be something, barrier between two of us. So we have to develop new communication skill to make more intimate relationship with our patients in spite of barrier between both of us. So this is task what we have to do together. Is that correct? Sufficient answer for you?
Yes, Prof. Thank you, Prof. So here is the last question. So, in your opinion, for the first-timer patient, what is the best way to build a rapport between doctor and also the patients?
What? Can you explain a little also again, please?
For the first-time patient, okay, can you hear me?
Yeah, yes, I hear you.
All right. So for the first-time patient, what is the best way or action to take to build a rapport between doctors and also the patient?
Good question. Very good questions. The rapport, which means the relationship with the dentist and patient, is exactly the same as we meet our friends. We need time, and then we need some endeavor, some effort to make the strong rapport. The initiative of this rapport is from dentist instead of patients. The dentist is responsible to build rapport, not by the patient. So the essence, the issue is how fast, how quickly we establish or we construct rapport in a given period of time. If we establish rapport as soon as possible, then the treatment will be more successful, than if we delay to construct rapport between patients. So the best way is, what do you think is the best way to build rapport as quickly as possible? I think this is sincere heart, honest heart. So I think honesty is always the best policy, even when we try to build rapport with our patients. Sincerity and honesty. I think that's the best way to build rapport between dentist and the patient. Be friendly, be honest, be sincere. I think that's the element, or that's the key to build rapport as quickly as possible. Thank you.
All right. Thank you, Prof, for answering the questions. All right. That's all for the Q&A session. And thank you, Professor Park, for answering the questions. And thank you to the audience for your active participation. We have certainly gained a thing or two from today's talk by Professor Yongguk Park. And ladies and gentlemen, and that's wrap up the final presentation by our esteemed speaker, Prof. Yongguk Park. Please be informed that the closing ceremony, you're most welcome, Prof. And please be
Thank you
informed
very
that the
much.
closing,
Thank you.
yeah,
Thank you. Thank you.
welcome. And please be informed that the closing ceremony will commence shortly. While we wait for the commencement of the closing ceremony, please enjoy a musical play put together by our Year 2 dental students.
Bismillahirrahmanirrahim. Assalamualaikum and a very good afternoon, ladies and gentlemen. Yang berbahagia, Profesor Datuk Dr. Muhammad Ibrahim Abu Hassan, Founding Dean Faculty of Dentistry, University Technology Mara. Yang berbahagia, Profesor Datuk Dr. Zainal Arif bin Abdul Rahman, Head of Judge, Department of Oral Maxillofacial Surgery, Faculty of Dentistry, UiTM. Yang berusaha, Dr. Muhammad Faizal Hafiz Hidayat, Chairman of 11th Dental Student Scientific Symposium 2021, Faculty of Dentistry, UiTM. Esteemed judges, deputy deans, head of departments, fellow academicians, and staffs, distinguished guests, ladies and gentlemen. Welcome to the 11th Dental Student Scientific Symposium Closing and Awards Ceremony.
Before we begin, let us usher in this auspicious ceremony by calling upon Mr. Ahmad Abid Arfan bin Ahmad Hafizat, our student of dental surgery, to recite a prayer. Please welcome Mr. Ahmad Abid.
Assalamualaikum warahmatullahi ta'ala wabarakatuh. In the name of Allah, the most merciful, the most kind. Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Wassalatu wassalam Sayyidina Muhammadin Ashrafil Anbiya'i wal Mursalin. Wa ala alihi wa sahbihi ajma'in. Allahumma antas salam wa minkas salam wa alayka ya'udus salam. فحينا ربنا بالسلام سلام سلم نجمعين واجعلنا من عبادك الصالحين. O Allah, I beg thee all of good things which pertain to this day and days hereafter and seek thy protection from all evil which pertains to this day and days hereafter. O Allah, you are peace, and all peace is from you, and all peace returns to you. O Master of power and glory, in conjunction of the 11th UiTM Dental Students Scientific Symposium 2021, guide us among those who you guide. Grant us health and pardon among those whom you grant health and pardon. O Allah, verily we seek you for the best supplication and the best success and the best deed and the best reward. O Allah, unite us and help us display the spirit of solidarity and unity to move forward in a single direction. O Allah, you are the most forgiving and one who loves forgiving. Therefore, forgive us and wish all delegates present in this 11th UiTM Dental Students Scientific Symposium 2021 a very pleasant and productive one and a memorable event for all of us. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وصلى الله على سيدنا محمد وعلى آله وصحبه وسلم والحمد لله رب العالمين.
Amin amin ya rabbal alamin. Thank you, Mr. Ahmad Abid, for the dua. Distinguished guests, ladies and gentlemen, the Dental Students Scientific Symposium, organized by the Faculty of Dentistry, University Technology Mara, was first held in 2011. This symposium not only showcasing research outcome from the Bachelor of Dental Surgery students, but also a platform for other students to show their depth of knowledge in 1. Postgraduate 3 minutes thesis 3MT competition, 2. Open dental quiz competition, and 3. Special care dentistry innovation competition regarding the dental, medical, and oral sciences as well as various clinical practices.
And today, the Faculty of Dentistry UiTM is proud to bring to you the 11th Dental Student Scientific Symposium 2021 with the theme Dentistry Against Odds, Revolutionizing and Research and Practice. This year, due to the current global pandemic situation, the symposium is being hosted as a virtual event. This symposium is aimed to expose and encourage dental students, especially Year 4 students' participation in research, and as well as build leadership qualities in students and encourage dynamic group practice. This symposium is also aimed to enhance students' professional ethics and interaction between students and lecturers. Besides that,
The objective of this symposium is also to encourage the university member towards research and academic excellence, and to publish all submitted abstracts in ISBN Proceeding Book.
Ladies and gentlemen, without further ado, please welcome the chairman for the Dental Student Scientific Symposium 2021, Yang Berusaha Dr. Muhammad Faizal Hafiz Hidayat, to give his welcoming remarks.
Thank you, MC. Yang berbahagia, Founding Dean, Professor Dr. Muhammad Ibrahim Abu Hassan, distinguished guests, all Deputy Deans, Head of Center of Studies, academic and supporting staff, international and our dear students. Assalamualaikum warahmatullahi wabarakatuh and greetings I wish to everyone. Alhamdulillah, we have managed to successfully end the UiTM Dental Student Symposium 2021. I would like to thank the Dean for entrusting the Center of Periodontology Studies to take this enormous task in organizing this year's Dental Student Symposium. I remember vividly at a meeting whereby Prof. Dato has told me that the coming Dental Student Symposium will be conducted by my COS. The bar each year of our Dental Student Symposium is high, and royalty closed the 10th Dental Student Symposium. Unfortunately, the COVID-19 pandemic presents an undaunting task in hosting this year's event. How are we going to continue this Dental Student Symposium? No face-to-face interaction, no student at the faculty, social distancing, strict SOPs. How am I to raise the bar for this year's Student Symposium? COVID-19 is a game changer in how we conduct scientific symposium. I would not envision myself having closing speech in front of a computer. Dentistry against all odds, revolutionizing research and practice. This year theme says it all. Despite the challenges we are currently facing, to host this yearly student symposium as a pinnacle to the completion of the Year 4 elective research projects, against all odds, our team managed to gather all in the virtual platform. The main outcome of this symposium is to expose our undergraduate students to realm and culture of dental research. Against all odds, this is the first in the history of our dental school in which we conduct this virtually. Against all odds, this is the first time students present their oral and poster remotely. Against all odds, this is the first time judges are judging remotely. Against all odds, this is the first time whereby our distinguished speakers are giving their talk remotely. And against all odds, this is the first time the audience are located remotely. From our website platform, www.uitmdentistrysymposium.com, the research presentation competition was telecast live for 2 days. A total of 50 oral presentation and poster presentation were completed for this year's symposium. Not only that, we are honored to have presentations from international students from India, Indonesia, Cambodia, and Japan. Postgrad students, on the other hand, have had the 3MT competition. Prior to the symposium, dental quiz was also conducted, and the winners will be representing our faculty in the National Dental Symposium. In addition, our final year student was involved in special care innovation, dentistry innovation competition. Our symposium is honored to have Prof. Dr. Noor Azia alias on the first day as a guest speaker with her talk on fostering a culture of responsive and responsible learning. And today we have the opportunity to have Prof. Dr. Yong Gung Park from Korea with his talk on the narrative medicine communication skills to facilitate listening and empathy. We would like to thank the sponsors for their generosity in supporting our conference. Colgate for sponsoring the trophies, the faculty for the prizes, and also sponsors of IFTA for the committee and student committee. I would like to acknowledge all of my steering committees and student committees for their dedication and commitment for this virtual symposium to be a success. Personally, I would like to acknowledge Associate Professor Dr. Nick Mazwan for realizing this virtual symposium. You guys really did a good job. Lastly, for the participants competing, win or lose, you all are winners. And thank you for your participation. Thank you.
Thank you, Dr. Muhammad Faisal, for the welcoming remarks. Ladies and gentlemen, now let us warmly invite Yang Berbahagia Professor Dr. Muhammad Ibrahim Abu Hassan, the founding Dean of Faculty of Dentistry UiTM, to give the officiating remarks.
Thank you, our MC this afternoon, Ms. Sabrina and Ms. Amil Hazin. Dr. Faisal Hafiz Hidayat, Chairman of Chairman of this scientific the DSS Symposium number 11, Deputy Deans, Heads of Departments, academic staff, judges, all judges, our two plenary speakers, Professor Dr. Azia and Professor Dr. Yogo Park, or they may not be with us this afternoon, and fellow students. I'd like to add our overseas guests, which is also available. Some of them are online this afternoon. And of course, to all the students who participate in this program, Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon. First of all, Alhamdulillah, all praise to Allah subhanahu wa ta'ala for giving us the opportunity to be here today. It's my pleasure to welcome everyone to 2021 Dental Symposiums. I would like to express my heartfelt gratitude to all my fellow lecturers, staff, and students for making this symposium a success. The Dental Student Scientific Symposium is an annual event organized by the faculty, UiTM. For this year, DSS 2021 is organized by the Center of Periodontic Studies along with our own very staff, lecturers, and students. Hence, I would like to congratulate the organizing committee for taking time to organize this program. And it's not an easy program, as what Dr. Faisal has said just now. This is the first time that we organize this event online, virtual. Okay. Of course, a lot of things has been done very well from what I've seen in the last 2 days. It's been conducted very well. All the slides are very clear and sharp, and it's very well planned, organized to have this conference. Although this is what we learned from COVID-19, it gives us to do something different. Of course, the excitement as having the closing ceremony online and face-to-face is different, because in a visual manner where we combine the closing ceremony on face-to-face, students will be there waiting to come and to hear the results. But unfortunately here, this time around, we only be hearing the results online. It's different from that, from where we face-to-face. Okay, with the theme of the dentistry against all odds, revolutionary research and practice, Dental Student Scientific Service is a great platform for everyone, especially undergraduate in postgraduate program, to explore the ever-growing field of dentistry and also provide knowledge of sharing between local and international dental students and staff. It is my hope that this symposium, with the involvement and collaboration from different backgrounds, will provide us from an excellent platform to share research directions and latest research outcome. DSS gives this opportunity and give the opportunity and chances for all of us to seek to build better foundation and to improve multitude experience in the scopes of dentistry. As dentistry paves its way into the mainstream of global clinical setting, we are here at the faculty strive to be at the forefront of innovation in this field. This symposium will be also a great way for networking, be it virtual, between local and international institutions, experts in the field, and practitioners, which benefit all of us. As we said just now, in the past student conference, we do not have speakers from overseas. As this COVID-19, we managed to get speakers from overseas, from our friends in Korea. As Prof. Yogo Park just now has introduced, he one of our good friends. He was a visiting professor to our school before, and that's why we thought of sharing our conference, inviting her to speak to our conference. Okay. Before I end this speech, I'd like to thank you, the sponsors, mainly Colgate, for sponsoring the trophies. And also, I'd like to congratulate all the staff led by Dr. Muhammad Faisal, who has organized and carried out this program successfully. I would like to again extend all my sincere appreciation to all the committee members for all their hard work in preparation and coordination for this honorable event. I really hope that this event will drive us further towards a new decade. And thank you all also to our supporting staff who has made this program successful. My heartfelt thanks to all the international delegates for their participation. Hope that we all will join us again in the future program next year, inshallah. So without further notice, I will now officiate the opening and closing ceremony of the National Dental Student Symposium 11 2020-21 with the theme Dentistry of All Odds, Visualizing Research and Practices. Thank you very much.
Thank you, Yang Berbahagia Professor Datuk Dr. Muhammad Ibrahim, for the officiating remarks. Distinguished guests, ladies and gentlemen, before we proceed to the next agenda, we present to you our montage video of the Dental Student Scientific Symposium 2021.
Prime Minister Muhyiddin Yassin says that interstate travel will also be banned nationwide.
Pfizer-BioNTech to arrive in Malaysia in February. Now they're hoping to roll out vaccination end of the month.
Thank you for the great video presentation. Ladies and gentlemen, dentistry is an amalgamation of both arts and sciences, which explains why our faculty is a melting pot for a myriad of talents. Now, let us sit back, relax, and enjoy a singing performance by our own homegrown talent and budding dentists, the second-year students of Faculty of Dentistry, for their rendition entitled A Million Dreams.
Ladies and gentlemen, moving on with our next agenda, we would like to invite Yang Berbahagia Professor Datuk Dr. Zainal Arif Abdul Rahman as the head of judge to present the feedback of the symposium.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. And a very good evening, everyone. Our Dean, Professor Yang Berbahagia, Professor Dr. Muhammad Ibrahim Abu Hassan, Chairman of the conference, organizing committee, professors, lecturers, students, ladies and gentlemen. First and foremost, I would like to convey my gratitude to the organizing committee for appointing me as a head of the judges. I'm very much delighted and honored for your kind gesture. And I would like to congratulate the organizing committee for the very successful conference today. Our presentations in all the parts, oral and posters, had been running smoothly. Thank you for the effort that they made by the organizing committee to make everything goes well. And we found that almost all the judges agreed that the students had successfully conducted the experiment with ethics and well-validated experiment. And the student had made the best effort to present their case. They make the best effort to win the prize, maybe, but everybody seems to train and practice well for the presentation. Most of the presenters in oral and posters, they present with a well-balanced English, with minimal of errors in terms of language. And we all judges have agreed that the overall majority of our judges had agreed, majority of our all the judges agreed that majority of the presenters have able to communicate the findings from their research well with the audience today. However, there are a few comments from the judges for future improvements of the presentation and the conduct of research as well. I start with the presentation itself. On the oral presentations, there are comments from the judges of the posters of the oral presentations that there are too many words on the slides. And I think this has been probably the common practice among all the presenters all the time. But for good control of the knowledge, to show to the audience that you have a good control of the knowledge of subject that you research, it is better for you to put a minimal number of words and explain it well, and try to make the best of using graph and pictures and so on. For the posters, we have the same comments as well. There are too many words on the posters and some using the font which is very, very small that it's difficult for the judges to read. And there are situations where the presenters block the posters because this is recorded. So when they block the posters, the judges could not read the posters. So I think this is a good point to note for the next symposium, that when they do the recording, try not to block the posters. As I mentioned before, in terms of flow of your communication, everybody speak with good clarity and a smooth flow. However, occasionally there is inappropriate usage of terminology. I mean, there's a classical example I'd like to mention here is that there are speakers who just use the word analgesia as analgesic effect as use. Let me rephrase it. When they've been asked a question about the analgesic effect, they just mentioned that it's energy produced by the antimicrobial effect of the material investigate. However, you cannot use the term analgesia on the material that relieve pain by controlling the infection. That is always been called an antibiotic. So just one of the classic examples. So have to be more careful in using your scientific terminology because it can be misleading to the audience. In the pertaining to the conduct of research itself, we start with a statement of problem. Majority of the research that been communicated today may be a bit obscure with their statement of problem and direction, and some have a study design that's not appropriately spelled out, and there's always occasion where there is dispute in the study design where on one hand is mentioned as systemic review, but appropriate procedures for systemic review has not been observed. And at many cases where the questionnaire is validation is not been mentioned, and the others is the other comment on the conduct research as well is where the clinical impact and direction of research is not well mentioned during the presentation. And I think we should be aware, as I mentioned, I like to quote this because it's a painful truth that we face today. We should know that 80% of healthcare research conduct worldwide has been wasted. Only 20% have their clinical impact. So we should not be part of statistics. Otherwise, we keep repeating the same mistake that been done in the past. We need to be aware that not necessarily all the research with laborious experiments or laborious and complex experiments has an impact. It's not all the time. Okay, there are some simple studies that have been done. As I mentioned to you, there are studies that I found which prove that the plaster of Paris, which have no cost, is as effective as the commercially available bone replacement material. So that is very impactful because the difference between the cost of the bone replacement material commercially available and plaster of Paris is uncomparable. Yeah. So although always things that laborious study with laborious experiment and have a better impact than the study with than a simple study. Yeah. That is about all on the comments from the judges. I would like to take this opportunity to thank all the judges for their hard work today, for not today, only for the last 2 days. Yeah. And for the participants, again, I would like to congratulate them for able to complete the studies and able to come up to stage and communicate their research with the audience today. There are winners among you. Congratulations to the winners, but those who doesn't win the prize, don't give up hope. Okay, keep on improving yourself. You get better someday. You win some prize in your career. With that, I end my speech. Wabillahi taufiq wa hidayah. Wassalamualaikum warahmatullahi ta'ala wabarakatuh.
Thank you, Yang Berbahagia Professor Datuk Dr. Zainal Arif, for the fruitful feedback of the symposium. Ladies and gentlemen, dentistry is an amalgamation of both arts and sciences, which explains why our faculty is a melting pot for a myriad of talents. Now, let us sit back, relax, and enjoy a singing performance by our own homegrown talent and budding dentists, the second-year students of the Faculty of Dentistry, for their rendition entitled A Million Dreams.
I close my eyes and I can see the world that's waiting out for me, that I call my own. Through the dark, through the door, through and no one's been before, but it's feel like home. They can say it all sounds crazy. They can say we lost our minds. I don't care if they call us crazy. Run away to a world that we design. Every night I'm lying there, the guidance colors fill my head. A million dreams are keeping me what the world could be, a vision of the world I see. A million dreams is all it's gonna take. A million dreams for the world I made. There's a house we can build, every room inside is filled. Things from far away. The special things I compile, each one there to make you smile on a rainy day. They can say it all sounds crazy. They can say we lost our minds. I don't care if they call us crazy. Run away to a world that we design. Every night I lie in bed, the brightest colors fill my head. A million dreams are keeping me awake. I think of what the world could be, a vision of the world I see. A million dreams is all To the world I close my eyes to see. I close my eyes to see. 'Cause every night I lie in bed, the brightest colors fill my head. A million dreams are keeping me awake. A million dreams. The world could be a vision of the world I see. A million dreams is all it's gonna take. A million dreams for the world we're gonna make. For the world we're gonna make.
Thank you to the second year Bachelor of Dental Surgery students of the Faculty of Dentistry for the wonderful performance. Distinguished guests, ladies and gentlemen, now we have arrived to the pinnacle of our ceremony, the award ceremony of DSSS 2021. May we cordially invite Dr. Nur Faiza Madbuhari, Head of Scientific Committee, to announce the winners.
I close my eyes to see. I close my eyes to
Now, the moment that everyone is waiting for.
Thank you to the second year Bachelor of Dental Surgery
Academics
students
has
of the
various
Faculty of
competitions held
Dentistry
virtually
for the
this year,
wonderful
including
performance.
the dental quiz competition,
Distinguished
our
guests,
first
ladies
ever
and gentlemen,
special academy
now we have arrived to the
competition,
pinnacle
our
of our
postgraduate
ceremony,
2-minute
the award ceremony
competition,
of
plus
DSSS
our undergraduate
2021.
research presentation.
May we cordially invite Dr. Nur Faiza Madbuhari,
We
Head
thank
of
the
Scientific
esteemed
Committee,
judges
to
and
announce
viewers
the
for
winners.
being part of our symposium this year, and also the whole team for making this event a success. Okay. I can feel the virtual suspense building up already from the audience. It's free. Good. This is for dental quiz competition. This competition was open to all students, a total of 100 students participated. Third place winner goes to Nur Faziana Muhammad Fazil, year 4. Now, the moment that everyone is waiting for.
Thank you to the second year Bachelor of Dental Surgery
Academics
students
has
of the
various
Faculty of
competitions held
Dentistry
virtually
for the
this year,
wonderful
including
performance.
the dental quiz competition,
Distinguished
our
guests,
first
ladies
ever
and gentlemen,
special academy
now we have arrived to the
competition,
pinnacle
our
of our
postgraduate
ceremony,
2-minute
the award ceremony
competition,
of
plus
DSSS
our undergraduate
2021.
research
May we
presentation.
cordially invite
We want
Dr.
to
Nur
take this
Faiza Madbuhari,
to
Head
thank
of
the
Scientific
esteemed
Committee,
judges
to
and
announce
viewers
the
for
winners.
being part of our symposium this year, and also the whole team for making this event a success. Okay. I can feel the virtual suspense building up.
for the ready from the audience. It's free. Good. For dental quiz competition. This competition was open to all enrolled students. A total of 100 students participated. Ami.
So the technical issue that we are facing just now. Hope that all of the participants can wait for any updates from our part.
Okay. I know the suspense is really building up right now. All right, let me start. Okay, for the dental quiz competition winners, third place winner goes to Nur Fazliana Muhammad Fazil from our year 4. Second place goes to Izzat Izzuddin Ismail Nudin, year 5. First goes to Muhammad Izzat Shaharom, year 3. Next. Sorry. Next, the winners for the Special Care Dentistry Innovation Competition. This competition was open for all Year 5 students organized by the Special Care Dentistry team. Okay, second runner-up goes to Group D, Mr. Gigi's Diary. First runner-up goes to Group A, Hush Cap. And the champion for the Special Care Dentistry Innovation Competition goes to Group B, Tridentionary. Okay, moving on to the winners for the postgraduate 3-minute thesis competition. Third winner is Unraveling the Enamel Loss and Evaluating the Aesthetic Effects of Resin Infiltration Icon. Presenter, Dayang Fazlina binti Abah Ibrahim, and supervisors, Dr. Norin and Associate Professor Anna Purni. Second winner goes to Unravel the Simplified Solution for the Fallen and the Wobbly. Presenter, Zalika Adila Zainurin. Supervisors, Dr. Nora Shikin Abu Bakar and Associate Professor Dr. Anna Purni Venkiteswaran. First place goes to Your Blood is Your Own Medicine. Presenter, Nik Fatin Sarah Nik Muhammad Abdul Nasir. Supervisors, Dr. Ernie Noor, Dr. Tan Sukeng, and Dr. Noor Hidayah Redwan. Finally, the time has come to announce the awards for our undergraduate research competition. Against all odds, despite all the challenges we faced during the past year and this year, we have had the privilege to listen to 50 virtual research presentations, which comprise 37 from our own Year 4 students and 13 presentations from our honored international participants from Universitas Indonesia, University of Putih Sastra Cambodia, Health Sciences University of Hokkaido, Japan, and from Cook Institute of Dental Sciences, India. Now for the first award, Best Presenter for International category. Third place goes to presentation by Lu Ling Kai, Alteration of Microflora and Antimicrobial Peptides in the Oral Cavity of Bee Pollen Fed Mice from Health Sciences University of Hokkaido, Japan. Second place goes to presentation by Shira Cynthia Islami, The Role of Oral Health Awareness and Knowledge in Smoking Cessation Motivation, Adolescents in Jakarta from Universitas Indonesia. And champion goes to Yoses Rivano Bakara, Universitas Indonesia Health Science Students' Knowledge Regarding Human Papilloma Virus-Related Oropharyngeal Cancer from Universitas Indonesia. Now, I will announce the best oral presentation from the main hall. Second place goes to the students, Nur Afikah Aina binti Amran, Nurin Hazirah binti Encik Muhammad Azmi, supervisors Dr. Amy Rajali, technologist Nur Hayati Muhammad Zain, title Antifungal Efficacy of Occimum Vesiculum, essential oil incorporated into tissue conditioner against Candida albicans. First place goes to students Anis Akilah binti Jafridin, Aliatul Afikah binti Azhar, title The Association Between Emotional Intelligence and Depression, Stress and Anxiety Amongst Undergraduate Dental Students During COVID-19 Pandemic. Supervisors, Associate Professor Dr. Budi Aslini and Associate Professor Dr. Marianti Mataso. The best oral presenter for the main hall, the judges had a difficult time to choose between two best presenters. So we have two best presenters from the main hall. The award goes to Nur Shaza Amni Ibrahim and Muhammad Rafizul Helmi Ramli with the research title Antimicrobial Effect of Heterotrigona Itama Propolis from two different regions of Malaysia against Enterococcus faecalis. Supervisors Associate Professor Dr. Iqmal Hisham, Dr. Hasna Begum and Professor Fuad Hussein. Now moving on to the best oral presentation from Magnolia 1. Second place goes to title Depression and Perfectionism Among UiTM Preclinical Dental and Medical Students. Students Muhammad Nazhan Shakir and Hanis Ilyana binti Abdul Alim. Supervisor Dr. Andrian Hussein. First place goes to title A Potential Ethnomedicinal Plant in Oral Healthcare and In Vitro Study of Sweet Basil Essential Oil. Students Nabilah binti Muhammad Amin, Fatin Atira Husna binti Nordin, Junaidah binti Mahmud, and other supervisors, technologist Nur Hayati binti Muhammad Zain and technologist Dr. Indah Muhammad Amin. The best oral presenter for the Magnolia 1 room is Nabilah Muhammad Amin. Title A Potential Ethnomedicinal Plant in Oral Healthcare and In Vitro Study of Sweet Basil Leaves Essential Oil. Moving on. The best e-poster presentation for Magnolia 2. Second place goes to title An App-Based Diagnostic Tool for Oral Medicine Teaching, a Prospective Survey on the Impact of Learning. Supervisors Dr. Harnani Harun and Dr. Eddie Hasrul Hassan. Students Hanan Anwar and Tengku Fatin. The first place goes to, for Magnolia Room 2, title Knowledge, Attitude and Perceived Harm of Vaping Behavior Among Medical and Dental Undergraduate Students at UiTM. Students Adam Harith bin Azlan and Muhammad Faris bin Muhammad Sobri. Supervisor Dr. Nur Faiza, Dr. Nur Nazahiyah and Dr. Nawal Alwani. Best e-poster presenter goes to Muhammad Faris Muhammad Sobri. Next, the best e-poster presentation for Magnolia Tree. Second place goes to students Nur Atikah binti Anwar, Arisha binti Abdul Murad, Supervisor Associate Professor Dr. Nik Muhammad Mazwan Muhammad Rosti. Title, The Use of Social Media by Dental Students, a Malaysian Perspective. First place goes to Universitas Indonesia Health Sciences, students' knowledge regarding human papilloma virus-related oropharyngeal cancer. Student Yoses Rivano Bakara from Universitas Indonesia. Supervisors Yuniardini Septorini Wimardani Ratna Kumala Indrastiti. And the best presenter goes to, for Magnolia Tree, Yoses Rivano Bakara. Now we have arrived to the most anticipated award for the undergraduate research competition, the Best Research Award. For this competition, marks are calculated based on students' performance during the symposium and based on their research paper. Second runner-up goes to students Nur Fatin Zulkifli, Nur Atira Azlin. Supervisors Dr. Nur Rashikin Abu Bakar, Associate Professor Dr. Anna Purni. Title, Students' Perception on Reflective Diary as a Teaching Aid in Learning Behavioral Management in Pediatric Dentistry, Qualitative Study. First runner-up goes to the winning title, Knowledge, Attitude and Perceived Harm of Vaping Behavior among Medical and Dental Undergraduate Students in UiTM. Students Adam Harith Azlan and Muhammad Faris Muhammad Sobri. Supervisors Dr. Nur Faizah, Dr. Nawal Alwani and Dr. Nur Nazahia. And the champion for Best Research goes to the winning title, The Association Between Emotional Intelligence and Depression, Stress and Anxiety amongst Undergraduate Dental Students during COVID-19 pandemic. Students Anis Akila Jeffrey Aliatul Afika Azhar. Supervisors Associate Professor Dr. Budi Aslini and Associate Professor Dr. Mariati Madaso. We also have special mentions for the outstanding effort and performance for best research paper among all the undergraduate year 4 students. The Reviewer's Choice Award, we have 5 winners for this category. First, the association between emotional intelligence and depression, stress and anxiety among undergraduate dental students during COVID-19 pandemic. Big winner today. Second, students' perception on reflective diary as a teaching aid in learning behavior management in pediatric dentistry, qualitative study. Third, perceptions of dental, medical, pharmacy and clinical health sciences students in University Technology Mara on people with disabilities and correlation with educational experience. Students Siti Nur Syahirah Mat Sokri, Nurul Nabila Sofri. Supervisor, Associate Professor Dr. Masur Alis. Fourth, depression and perfectionism among UiTM preclinical dental and medical students. Winners, students Muhammad Nazhan Shakir, Hanis Ilyana Abdul Alim, Supervisor Dr. Andrian Hussein. And finally, UiTM Dental Students Perspective on Novel Educational Kit, students Nur Shakira Abdul Aziz and Nur Khalidah Sabrina Ikmal Hisam. Supervisors Dr. Tan Su Kang and Dr. Michelle Claire Ma. That marks the end of all our awards for today. Congratulations to all winners. Till we meet again next year, have a blessed Ramadan and thank you very much. Assalamualaikum.
Thank you, Dr. Faizah Buhari. Congratulations to all the winners. The full list of all the winners will be posted on our website after this event.
Distinguished guests, ladies and gentlemen, we have reached the closure of the 11th Dental Students Scientific Symposium 2021. On behalf of the organizing committee, we would like to express our sincere appreciation and gratitude to all invited guests for gracing this event today. We would also like to thank our generous sponsor, Colgate Palmolive Sendirian Berhad, for the contribution and support in making this symposium a successful one. Please accept our heartfelt thanks for your kind generosity. We look forward to your sponsorship participation in the next symposium.
To all participants, we hope that you had a great and fruitful symposium. We also wish everyone and our university every success in our quest for higher excellence. But before we bid our final goodbye, let us enjoy a short video presentation of our hardworking committee. Please enjoy. Bunga seroja di atas para, jatuh ditimpa buah berangan. Andai kata tersilap bicara, kemaafan jua kami pohonkan.
Dari Kedah ke Pekansari, beli suasa di kota tinggi. Selesai sudah tugas diberi, di lain masa bersua lagi. Till we meet again at the next symposium. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Please enjoy a performance of Selamat Hari Raya, sung by our second year students. Thank you and selamat berbuka.
Indahnya sungguh di hari raya, ramainya orang bersukaria. Indahnya sungguh di hari raya, ramainya orang bersukaria. Adikku manis, cantik bergaya, bolehkah abang ikut bersama? Adikku manis, cantik bergaya, bolehkah abang ikut bersama?
Salah membuang waktu, mari menuju ke rumah bunda. Salah membuang waktu, mari menuju ke rumah bunda. Sana saudara, saudara.
Katamu itu abang mengerti, ku sanjung budi puteri ibunda. Katamu itu abang mengerti, ku sanjung budi puteri ibunda. Pada yang tua kita hormati, barulah hidup saling bahagia. Pada yang tua kita hormati, barulah hidup saling bahagia.
Miskin dan kaya sama saja, ulurkan tangan berjabat mesra. Miskin dan kaya sama saja, ulurkan tangan berjabat mesra.
Saling bermaaf kita bersama, lupakan saja sengketa lama. Saling bermaaf kita bersama, lupakan saja sengketa lama. Selamat Hari Raya Aidilfitri, maaf zahir dan batin.